I think we all know that health insurance is so important here in the United States. You probably have a family member or a friend who has really struggled with their medical bills. In fact, I've heard that over 500,000 people per year declare bankruptcy due to medical bills. So having health insurance is essential to cover these healthcare costs, particularly in the disability community. So let's look at the different types of healthcare programs that the government provides, and we'll see the pros and cons of each program. So the two main health insurance programs provided by the government are Medi-Cal in California, which is California's version of the federal Medicaid system, and Medicare. So you might be wondering, hey, I'm receiving one or both of those. Which one am I receiving? Okay, so to find out which health insurance program you're receiving, just look at your card. And it'll say something on your card like Health Plan of San Mateo, if you're in San Mateo County, or San Francisco Health Plan, or Santa Clara Family Health Plan. All of those are Medi-Cal programs. The card might also say just plain Medicare, then you're receiving Medicare. And some people we call Medi-Medi. They're receiving both. All right, so I want to break this down. And first I want to talk about Medi-Cal and all the different ways out there to receive Medi-Cal, because you may not know this, but there's like 7 or 8 different ways that you can receive Medi-Cal. So the first way is for children. So children in California are now covered under a waiver program, which is basically a grant that California provides for all children under age 19, so 18 and under. And this is any child, whether they're documented or not, they can get Medi-Cal, all right? So your child might receive Medi-Cal. Now your child might be disabled or might not be. They might be covered under your health insurance program, but if there isn't a health insurance program available to them, they should be under California Medi-Cal. Okay, so the second type of Medi-Cal eligibility out there is if you're receiving Supplemental Security Income, SSI, then you automatically receive Medi-Cal. All right, so if you get just $1 of SSI, which is an income stream for those who have under $2,000 of countable assets, just $1, then you qualify for Medi-Cal, which is really nice. Now, I do want to point something out. There are some people who initially get SSI and then it switches to child disability benefits later on. And I actually have a video of how that happens called SSI versus SSDI. And so I suggest you watch that video. But if you are receiving Medi-Cal because you were getting SSI and now you don't get SSI anymore, guess what? Medi-Cal does not have that same $2,000 countable limit anymore. So you might want to switch from that Medi-Cal to a different eligibility for Medi-Cal, and I can let you know which ones, so that you don't have to keep your assets under $2,000 anymore. All right. Nowadays in California, SSI is really the only program that they're looking at your assets and you have to have under $2,000 of countable assets. Okay, so then you say, well, Ellen, what program can I switch over to? So this program, it's called the Aged and Disabled Federal Poverty Level Program for Medi-Cal. I know, it's a big long term, all right? But basically that's somebody who's disabled and they need health insurance, okay? So that used to be the under $2,000 of countable assets, but that's changed. Right now in 2023, we have an asset limit of $130,000. And then starting January 1st, 2024, that asset limit is being eliminated. Yay! And I actually have a video where I talk you through how and when that's happening. But that program still has an income limit. It's about $1,470 a month. So you have to, if you're on Medi-Cal, you need to have your income stay under $1,470 a month. So what happens if your income goes over $1,470 a month? Well, then you switch to a Medi-Cal share of cost model. So what that means is now you are paying, after I think about $600, then you have to pay your income towards the cost of your health insurance coverage. So, whatever bills have lined up, you might have to be paying for that, and that can be very expensive. So you really want to keep an eye out on your income limit so that you don't have to do Medi-Cal share of cost. Another issue is if you have an elderly parent and they need to go into a nursing home. Well, Medi-Cal actually covers the cost of skilled nursing care for long-term stays. So the elderly person needs to become eligible for Medi-Cal. And again, that would look like the disabled, that it's essentially the same eligibility limits as the one that I described with no share of cost. And then Medi-Cal will cover a stay in a skilled nursing home that accepts Medi-Cal. Not all skilled nursing homes do, but some do. Okay, and then we have what we call MAGI Medi-Cal. That's the one where they actually just look at your income on your tax return and they say, okay, are you low income? And if your income is low enough, you qualify for Medi-Cal. So this was really the Medi-Cal, it was the expanded coverage when we got the Affordable Health Care Act. Now more people can qualify for Medi-Cal. I believe it's 250% of the federal poverty level. If you have that much income or less, then you can qualify for Medi-Cal. So they don't look at your assets at all. They look at your income and they calculate it slightly differently. So look at this. There's so many different ways to qualify for Medi-Cal. So you might be receiving Medi-Cal one way and you're like, wait, this isn't working anymore, such as, Medi-Cal through SSI, and you say, I need to change it. Then you could do another application and switch to eligibility through a different Medi-Cal program where, your child is receiving Medi-Cal under age 19, and then they need to switch over to a different Medi-Cal program, and that's just fine. So what about Medicare? Well, I think a lot more people know about Medicare because everybody age 65 and over can qualify for Medicare in the US, all right? And I actually know some people who have had Medicare parties. They turn 65 and they're celebrating getting Medicare, all right? Now I know that it doesn't cover everything, and so we're gonna talk about that. But one way to qualify for Medicare is just turn 65, easy. Another way to qualify for Medicare is if you're receiving Social Security disability insurance or child disability benefits for 2 years and 5 months, then you qualify for Medicare. So that's one big reason why you might want to look into whether your child qualifies for child disability benefits, because after about 2.5 years, they can get Medicare. And again, they can be covered by Medi-Cal and Medicare, the Medi-Medi, and that provides a lot more comprehensive coverage. Okay, so as you may know, there's 4 parts of Medicare. There's Part A, which is hospital insurance. So that's inpatient hospital care, skilled nursing care, home health care, and hospice care. All right, so whenever somebody's on hospice, this is the Medicare that covers it. And also, as we were talking about the skilled nursing care, Medicare does cover skilled nursing care as long as somebody is recovering or at least they've plateaued. If they're slowly declining in their health, then Medicare stops covering them. So you can't really rely on Medicare to cover a long-term nursing home stay. Okay, so then there's Part B, which is medical insurance. So this is kind of your regular doctor's services and outpatient care, preventative services, diagnostic tests, therapies, and medical equipment. So this is what most of us think about when we think about Medicare coverage. Then there's Part C, which are Medicare Advantage plans. And then Part D are prescription drug cost plans, okay? So sometimes you'll pay a supplement to cover some of these parts. Now keep in mind, Medi-Cal does a really good job covering prescription drug costs. So if you have Medi-Cal, then you might not need to pay as much for Medicare for the prescription drug coverage. But it's something to look into which one covers what, and how do you get the most comprehensive coverage that you might need. So as I mentioned earlier, I do have a video on Medi-Cal eligibility updates for 2023, and I suggest you go there to find out more about these changes in Medi-Cal rules, and I'll see you over there.